Hi, sir.
Hi.
We are about to start.
Yeah, actually, I'm looking at your page. Is it going to be a separate video?
It's streaming on YouTube, sir.
In YouTube only, because it's live, right? Yeah, it's on. Right.
A warm good evening, all. I am Nandana V, first year MBBS student. It is my pleasure to welcome you all to the first session of the lecture series conducted by MEDMEET 2.0, organized by the College Union 2022, Calicut Medical College, in association with the DOCTUTORIALS. MedMeet 2.0 is a grand academic festival celebrated with renowned faculties and budding doctors across the globe. Today, in this session, the first session of lecture series, the topic is how to write a prescription. So, for that, with us is Dr. G. Nilesh Raj, one of the vibrant doctors and renowned faculty serving as Senior Assistant Professor, Department of Pharmacology, Government Tiruvannamalai Medical College Hospital, Tamil Nadu. Welcome, sir. We are eager to hear you. Over to you, sir.
Hi everyone. Good evening, and I hope I met you at the right time. And before starting the session, I just want to give you a small warning that this is going to be very much crisp presentation as much as possible. Because how to write a prescription, of course, majority of you would have written a prescription long before, even before joining your MBBS itself. I hope that because prescription is something like which even a small child, when that child wants says that she or he wants to become a doctor in the future, she'll be doing some certain gimmicks to their parents by wearing a stethoscope, by doing something, and at last she will be writing a prescription. So we have some basic concepts. Prescription is a very much basic thing, and that's what we're going to explain about for this session today. I hope I am free to go proceed further with the sessions. So let's start with the first slide. How to write a prescription. Before that, I am Dr. Nilesh, a faculty for pharmacology. I'm working as a faculty in DOCTUTORIALS, and also I am a senior assistant professor in Government Tiruvannamalai Medical College, Tiruvannamalai, which is there in Tamil Nadu. Apart from that, I'm taking sessions in many different areas, which is I'm just a little bit passionate in teaching. So I'm just going here and there to teach and to explain what I exactly know. That's it about me. So we'll move towards the session. In this session, what we are planning to see. The first one, what is exactly a prescription? Second one, what are the essentials for writing a prescription? What are the parts of prescription which everyone already know? Superscription, inscription, subscription, and transcription, errors in prescription, and how to prevent or how to avoid those errors in prescription. This is the sequence in which we are going to explain things. See, guys, I'm just again explaining that this is not going to be longer because everything you know, majority of you know. But the point is, we have some small nuances which you have to understand. The recent changes which we have, the GOs which was released from the NMC. We're just going to incorporate that in this session. First, let's start with what exactly is a prescription. A prescription is actually means I write before, which means, see, guys, previously when we were dealing with, to say, plants, and we were deriving newer drugs, we are mixing drugs with the help of pestle and mortar, and we administer it to the human beings. At that time, you know how the things was happening. See, I was not alive for that to look at that because it's purely based on what I have read. So what I have read is these doctors, used to see the patients, and they will be deciding on adding up this plant, some 4 or 5 leaves of this plant, 10 leaves of that plant, and add some kind of water, and mix it, and make sure you prepare a particular molecule and give it to the patient. The doctor at one point of time cannot do all these things in the backdrop because a lot of patients were waiting in the line. That's the reason why the doctor, or to say why the medicine decided to have pharmacists nearby. The actual function of a pharmacist is the doctor will see the patient, will write down that this is the name of the patient, the details of the patient, the age of the patient, and if this patient comes to you, please give this kind of things. First, add 4 leaves of this plant, 5 leaves of that plant, add some water in it, and do some mixing in it, prepare a solution, and give it to the patient, and ask the patient to get the solution back after ask the patient to come back after 10 days to get the solution again. So prescription is what we write before we administer the drugs to the patient. Prescription means I write before. This is going to be a written order. In some cases, we have verbal orders too. In terms of emergencies, we have verbal orders. Every hospital should be having a separate SOP, standard operating procedure, of how to follow a verbal order and how to follow a written order. If it is, of course, it should be there in that in the great college which you are studying right now, Calicut. But if we don't have, it is always recommended to have a separate SOP to what are the different categories with which we have to follow a verbal order and a written order. It must be written by an authorized person. In some countries, a clinical pharmacist can prescribe a drug, a nurse can prescribe a drug. But in India, only a registered medical or a dental practitioner alone can prescribe a medicine. And it must be prescribed to the pharmacist. It's a basic and the most important concept here, buddies. Prescription is what we give it to the pharmacist. We don't give it to the patients. We shouldn't give it to the patients. This is what we explain to the pharmacist, like, see, you have to mix up this four leaves of this, 4 leaves of that, and mix it with water and administer it to this patient who is coming up with this name, with this identity. But currently what we don't do these mixings and all, right? The pharma companies used to do that. So the pharma companies will do all these mixings and prepare a prepare a tablet or a capsule, and it is going to be there in the market. So what you do, you write the you inform the pharmacist that if this patient comes with this identity, give this tablet to this patient. So a prescription is practically a thing which we order a pharmacist to give it to the patient, not to the patients, for dispensing certain medicaments in a particular form in specified quantity to a specified patient. This is what exactly a prescription is. Moving on further, what are the essentials for writing a prescription? If you want to write down a prescription, what are the basic things which you need? Point number one, you should have a sound knowledge on pharmacology. In India, we have a separate subject named as pharmacology, guys, but it is not going to be there. It is not going to be there in many other countries. uh, we have a concept called as clinical pharmacology, and that is those medicine people or the cardiologists will deal with those pharmacology which are concerned with their own subjects alone. But in India, we have a separate subject named as pharmacology, and we have a separate super specialty called as clinical pharmacology, only because of the humpty number of patients which we see daily. Point number two, proper selection of remedies. This is purely based on the knowledge which you gain from your undergraduation. Knowledge of posology. Posology is nothing but the dosage of drugs which we administer. Knowledge regarding the effects of combinations of remedies. What will happen when two drugs are given together? What are the synergism? What are the antagonism? And what are the other combination effects which can be expected? With this basic knowledge, you have to go up with the prescription. Apart from that, a prescription must be made sure that it must minimize risk to the patient, it must minimize cost to the patient, it must respect patient's choice, and it must maximize the efficacy which can be administered with the certain drugs. Please have these four major pillars in a prescription, guys. There must be less risk, less cost, more efficacy, and you have to have respect on the patient's choices. After writing a prescription, it must be like, is that okay for you? You have to ask the question, is this okay for you? What if the patient says, for example, a patient comes up with an infection, you prescribe an antibiotic, and the patient says that you just prescribe the antibiotic and the patient leaves the area, and then the patient, you didn't ask the question, is that okay for you? But exactly what has happened is, just before the patient has visited you, the patient has already completed a full course of antibiotic. There is no need to administer one more antibiotic in that same prescription. So you have to ask the question, is this drugs okay for you? These are the essentials before writing or for writing a prescription. Moving on to the first and the most important one, parts of a prescription, which everyone knows already. Superscription, which contains the details of the doctor and the patient. We have the symbol RX. We have inscription, which is the medication which is prescribed. Subscription, which is the direction to the pharmacist, and transcription, which is written at last. We're going to explain about every individual parts of prescription and how we have to write individual parts. First, let's talk about the superscription of a prescription. Superscription, as we already know, it must contain the doctor's details. It must contain the name of the doctor, address, the medical registration number, and the date of the prescription. Point number two, we're going to move towards the patient's details. What are the details of the patient which has to be entered in that? Name, age, sex, address, and weight of the patient, especially when the patient is of a pediatric. When especially if the patient is from a pediatric OPD, we have to write down the weight of the patient. Most important one is what is going to be popping up in the next one, allergy history or allergy status. Please make sure that currently we don't use it, we don't write it regularly in our prescriptions. Even in government prescriptions, we don't find this allergy status. We don't even have a separate column for that. Now even in governments, we don't write on prescriptions, guys. We have lots of, for example, I'm working in Tamil Nadu. We have a separate software called as hospital information management system, HIMS. So the doctor will be seeing the patients, he will be entering the patient's ID and the PIN number, he'll be entering the diagnosis history, the drugs to be prescribed. The patient will go back to the pharmacist, will give that PIN number, the pharmacist will enter that PIN number in his system, and he's going to be looking at what are the different drugs, and he'll be giving those drugs to the patients. But it is difficult, even till now we don't have a separate column called as allergy status in this. We are trying to include that, which is very much important. And the last one, we have to write down the provisional diagnosis, or even if we have finalized, a definite diagnosis also is always been advised. That's it about your superscription, guys. Moving on to the next one, the symbol RX. What exactly is this symbol RX? Everyone knows RX means you take, I ask you to take these medications. That's what RX is. RX, we have lots of histories of the term RX, guys, but one important term is there. RX used to be saying that it's an ancient symbol of Zeus or Jupiter, the Greek god Zeus or Jupiter. The ancient symbol is RX. We have utilized the same thing. And also one more concept is there. Previously it is not called as RX, it is RC. It's actually RC. That C along with the lower stroke of R has joined together, and later on it has been changed to RX. Lots of different theories are there, but you know what is important? The thing which is coming below that RX is what is important, right? That's what we're going to look at it. We're going to look at what exactly is inscription. Inscription, this is what the most important, the heart of a prescription is, the medications which is going to be prescribed. Please remember 7 points in writing down a prescription. What are the 7 points in it? Point number one, the dosage form, whether it is in the tablet or syrup or suspension or injection. Please write down the dosage form, number one. Number two, write down the drug name, especially follow the generic names. If you write a trade name in your prescription, there is more chance of you to get penalized, because that's what the latest GO which has been released by the National Medical Council tend to say. You have to write only generic drug names. What exactly is the generic drug names? Simple. Paracetamol is, or acetaminophen is the generic drug name. Dolo or Calpol or Vixaxin 500 or any other things are going to be the trade names. So you have to write down the generic names, and you have to follow tall man lettering. If you're doing it systems, no one is going to be asking a question, but you are going to write down, for example, if you're going to write down a prescription, it is always advisable to write down the drug's name in capital letters. Make sure you don't use any abbreviations. Please don't write CPM. Please write chlorpheniramine maleate, right? Please don't write DEXA. Write down dexamethasone. This is an important one. Try to make sure. Of course, we know we are also from government colleges. It is difficult. We won't be having enough amount of time to write down the full name. We think that, but make sure that instead of to say wasting time in many other things, we can concentrate more on this prescription, which is going to be the most important one. We have to make sure that there is no communication error between you, pharmacist, and the patient. To prevent that, please try to use these basic concepts. Number three, write down the doses in milligrams per kilograms. Not in, please don't write paracetamol 500 milligrams. If we have the concepts, write down 10 milligrams per kilogram, multiply it in weight, and the pharmacist has to do that. Usually, doctors have to write only the per kilogram doses. Pharmacist has to multiply it based on the patient's weight, and then he have to do that, because we don't have the time to do the calculations. But currently we have a fixed dose which has been supplied in many different medical colleges, so we are writing only those 500 milligram, for example, I'm saying. So we got accustomed to that, the same mistake which we already been doing. So please make sure that you write down the doses in milligrams per kilogram dose. Point number four, write down the route of administration, per oral or intravenous or per rectal or sublingual or buccal, etc., etc. Five, write down the frequency of administration. Frequency of administration means per day, how many times you have to give that tablet. How many tablets and how many times you have to give it. OD or BD or TDS. These three are older nomenclatures. Now, it is not advised to use OD, BD, or TDS. It is always advised to use the term once daily, twice daily, thrice daily, because Latin words are currently not being preferred to be written in a prescription. Point number six, duration of therapy. 5 days or 10 days or 15 days. And the last one, after or before food. The food and drug interaction is very much important here. So I have given you 7 different points, guys. Dosage form, drug name, which is going to be there in generic, dose, route of administration, frequency of administration, duration of therapy, after or before food. This appears like bits and pieces, right? I'll just give you with a classical example, inscription example. Consider a patient is been there visiting you with fever. You are going to prescribe paracetamol for that patient. How do we write the prescription? Tablet, paracetamol. Please note we have written it in tall man lettering. 10 milligram per kilogram. Basically, we administer 500 milligrams per oral, one tablet, 3 times daily. It is always preferred to write down the time. Instead of vague terms like 3 times daily or 2 times daily, the patients might take 3 times daily means morning 8 o'clock, 11 o'clock, and afternoon 2 o'clock. There is more chances of it. To prevent that, it is always advisable. Even some countries tend to say, please don't even write 3 times daily. Write down the time directly in the prescription. That is going to be enough. So for our condition, what do we do is, please write down one tablet 3 times daily, morning 8 o'clock, afternoon 2 o'clock, and in night 8 o'clock. For 5 days, and we have to write from the starting date. If you write the duration of therapy, please write down the starting date of therapy in that. And last one, after food. So I have given you 7 different points here, guys. Tablet paracetamol, 500 milligram per oral, one tablet 3 times daily for 5 days after food. Please make sure you write down all these 7 different points in any drug if you administer. Moving on to the next one, subscription. What exactly is this subscription, guys? We have seen about superscription, RX, inscription, and now subscription is nothing but how to dispense the drug. It's nothing but a direction which we give to the pharmacist of how to dispense certain drugs. This is like, for example, we might be having certain drugs which might be photosensitive in nature. We have to ask the pharmacist to give it in such a way that it is not going to be exposed to sunlight, or certain drugs will be make sure that we have to keep it in fridge, right? Certain drugs has to be maintained at a temperature of 2 to 8 degrees Celsius. You have to make sure that you have to ask the pharmacist to inform the patient that these drugs has to be kept in fridge, these drugs has to be kept in this different area in the fridge. That's the subscription which we have to administer, and that thing you have to write it down in the prescription itself. The last one is transcription. What exactly is transcription? Is purely the certification of that particular prescription. Please make sure that it must be done in his or her own hand. The doctor must be doing it in his or her own hand. In government colleges, usually we don't do it. Instead, what we do is we have a particular concept called as every doctor will be having an unique ID. Only if you put that ID and put that password, you can log in into that software, so that thereby we can enter the drug names, which means we make sure that if a doctor has been prescribing this particular drug, it means only he can do it. That password is what that transcription is. So here we don't usually put signature in government setups, but in private setups, you have to write down the prescription in your hands. You have to put your signature. You have to put your signature and your registration number in that prescription, and which might also include contact number for emergencies. We never do that. We don't have that till now. Please make sure that you write down those emergency contact numbers in that. For example, if you are working in your if you're going to be working up in your clinic, and you're having your pharmacist number is there, or your one another number is there, please don't. Always it is not advisable to give your personal number in the prescription. You can have a separate number or a pharmacist number. From there you can get the referral. But as per logic is concerned, personal number is always advisable, but practically it is very much difficult, because we as practitioners, we know the difficulty of it. That's it about the 4 major parts of prescription, guys. We have seen about superscription, the inscription, subscription, and transcription. This is the model example of, sorry for that. Yeah, I hope I'm normal again. Good. So
Yes,
this
sir.
is a classical example. Yeah, this is a classical example of a prescription, guys. So consider we have the doctor's name and address, we have the patient details, we have the diagnosis which is written here, and we have the treatment RX symbol which is given, and we have the inscription, tablet phenytoin sodium. We have written the dose. We have given how many tablets to be dispensed. One tablet taken orally every 8 hourly. See, we have written the time over there: 6 a.m., 2 p.m., and 10 p.m., and after food also. Review after a month, the follow-up, the advisory to the patient, all these things will come under subscription, guys. Please come after a month for review, whether any refills are going to be there, do we need to substitute this drug if it is not available. All these things has to be involved in that prescription. Don't forget to write down the date of the prescription, which we have already done it in the initial time itself, and you have to write down the signature with your registration number. Moving on to the last part of this session, guys, errors in prescription. What are the common errors which we can face? Of course, majority of you can guess what exactly might be the errors. Point number one is inadequate knowledge of the patient. You don't have time to ask questions to the patient. That's the major issue which we commonly do. We don't ask what type of allergy the patient has, or what the drug which the patient is already been taking. Please make sure you ask these questions and then you write down the prescriptions. Number two, inadequate drug knowledge. Very common, guys. I just want to say it very openly. I am a pharmacologist. I have around 30 to 40 percentage drug knowledge, right? And of course, please think about yourself, because of course you might be having more drug knowledge. I'm not going to be asking regarding that, but there is, please make sure that whatever knowledge which you gain, there is going to be still more in that particular drug. Clear? Because you're just following some books or some references which you have think, but it is you have not founded that drug, right? So you're just following references. There will be lots of references. We have to learn a lot of things regarding an individual drug. Everyone knows paracetamol. Of course, you have taken at least 10 or 15 paracetamols in your life, or I have prescribed around hundreds of thousands of paracetamols in your life, but still there are lots of things regarding paracetamol. Paracetamol and its relationship with alcohol liver disease, paracetamol and its relationship with malnutrition. Lots of different things are there. As I've told already, many different concepts are still being there to learn. Calculation errors very common. Of course, we are doctors. Why did we become a doctor? Because we don't know maths. That's the reason why we became a doctor. 10 into 100 is equal to 110. Please don't do that. Illegible handwriting, very very common, most important one. That's the reason why the whole government, the whole people are trying to invest crores in developing a software to prevent this kind of illegible handwriting because of us. Why is there an illegible handwriting? God only knows, right? Because I was having one of the most beautiful handwriting in my school times, but I don't know how it is entirely being changed. It is not seen with any other professions, but it is seen only with medicine profession. There is some curse, I suppose. People used to say we write a lot. No, 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 that's not the reason. We have Lassa drugs. What exactly is Lassa drugs, guys? Look alike, sound alike drugs. Look alike drugs might be looking very much alike, which has got least issue with doctors, because pharmacist has to have that basic concept. Sound alike drugs, it's a very much important. Diltiazem, clonazepam, or clonazepam and alprazolam, all these drugs will be sounding very much similar. It might be easier for you, especially in terms of verbal orders in words. You will be saying regarding a drug, but unfortunately the thing which is reaching there is going to be different. You have to have a knowledge on what exactly are the Lassa drugs, look-alike and sound-alike drugs, and make sure that when you give a verbal order, you repeat those drugs names at least 2 times whenever you give a verbal orders in your words. Yeah. Last one, poor history. As I've told, not including the allergy history. We don't do that. Only if you do that, we can prevent the errors in prescription. Coming towards the most important part, how do we prevent the mistakes which is happening in this particular session, in this while writing a prescription? Point number one, this is regarding the illegible handwriting, guys. I've told you, right? When you write on a prescription, it's very difficult for the other guys to read. How do we do that? Is you test your preparation with your non-medical friend. Write a prescription having complex drugs using the same mechanism which I have told previously. Use tablets, like you write the dosage form, use tall man lettering, and try to make sure that the patient is not getting confused. Try to write on all these things with a time limit and give it to a non-medical friend and ask him to read that prescription. Only if that friend tends to read that prescription without any errors, you are point number one. You have clicked it, right? Second point, write dose units using tall man lettering. Not only drug names, even dose units has to be written in tall man lettering. What exactly is dose units, guys? Milligrams or grams, all these things. Usually what to do is milligram, and we have microgram. When you write mg, it is milligram. When you write mcg, it is microgram. You believe that the pharmacist will know. How can a pharmacist give uh, to say 200 milligrams of thyroxine tablet? It's practically impossible, right? You have the belief on that unknown pharmacist, but please make sure that you have never seen that pharmacist in your life. You don't know his knowledgeable, how much knowledge he might be having. And most importantly, when the patient is taking up the prescription, moving towards one more area, there he is going to be showing the same prescription to some other pharmacist. They don't even know what exactly is happening. Make sure that Not only the drug names, even the dose units, you write it up using Tallman lettering. Avoid decimals, very important. For example, consider you are going to write down 3 to say some 5.4 grams. Consider you are planning to write 5.4 grams. When you write 5.4, make sure that the point is very much visible. If you think that it might not be visible, you can simply write down 5400 milligrams. That is going to be enough. But more than 1 gram, it is always preferable to use decimals. But when it is less than 1, please don't use grams like zero point 0.7 grams, zero point 0.6 grams. Please don't use that. Write down 600 milligrams or 400 milligrams. Please try to avoid decimals where all you write. Please have some knowledge. Please have some deeper thought in it. If you want to write decimals, please don't write 0.5, write 0.5. These are small communication errors between you and the pharmacist. As I've told, microgram, milligram, nanogram should not be abbreviated. Please don't use abbreviations. Very important one. Sign with a black indelible ink. It is always advisable to sign with a black pen. Not only for prescriptions, guys, even for official documents, even for land related, registration related documents, or agreement related documents, it's always advisable to sign it with the black ink. Always use that in your prescriptions also. The next one, how to prevent the mistakes. Directions written in full English, avoid Latin. As I've told, please don't use OD, BD, TDS, QID. Previously, long before when we were teaching pharmacology, we will be explaining the abbreviations used in medical terminologies like QID, what is HS. Please don't get confused with it. Please write it full English. Please avoid Latin in your prescriptions. Avoid teaspoons or tablespoons. Please don't use that in your prescription. People won't even know what exactly is a teaspoon and what a tablespoon, because we don't have a thing to use for tea. We don't have separate spoons, and for table we don't have separate spoons. We have only one spoon, which in Tamil we used to call it as karandi. Right? It will be like a bigger one. Right? We use it the same thing even for eating noodles. To drink a soup, we use the same spoon only. There is no difference being called as teaspoons or tablespoons. Please don't use that in your thing. Please make sure that you write down how much ml they have to write it down. 4 ml or 5 ml or 10 ml. Please write it down the same one. Specify time rather than vague terms like 3 times daily. That's what I was explaining about previously. Please don't write 3 times daily or 2 times daily. Write down the time at which the patient has to take. For example, methotrexate is a drug which can be used for psoriasis and for many other conditions. Rheumatoid arthritis. Methotrexate has to be taken weekly, right? Every weekly we have to take the tablets. Usually what we do is whenever we administer it to a patient, we just mix it with them with their regular things which they're doing. For example, if the patient used to watch a particular serial in his TV every morning, or to say every Sunday evening by around 4 o'clock or 5 o'clock, he'll be watching that serial regularly. You just mix it with that. Before watching that serial, you have to take this tablet and watch that serial. Just mix it with the regular thing which the patient is doing, so that the patient will not get weaned off. Even if the patient couldn't watch that serial, he would have forget about taking the drug, but he would not forget watching that serial. He would not forget that he has missed that serial also. So this, you're just linking that tablets to be taken and the regular thing which is to be done. Write diagnosis to all prescriptions, whatever it might be. Even if you can't write the diagnosis, if you don't even know the diagnosis, write down the symptoms in a briefer manner. That is going to be enough because pharmacist needs to understand certain concepts. And the last one, never pre-sign a blank prescription. You shouldn't sign a blank prescription, which everyone knows, because there is lots more chances of misuse of that. And apart from all these different mistakes, or to prevention of mistakes, one important thing is, please don't cross in a prescription. Please don't strike out a drug in a prescription. Please don't overwrite in a prescription. For example, you write down injection tramadol for the patient, and you give a single injection, right? Injection, you just give a single injection. And what if the patient is actually an opioid addict patient, and he converts it into 7 injections? And when he gives it to the pharmacist will look at that prescription and he will think that this doctor always overwrites, so this is like one more overwriting only. He will be giving 7 injections to that patient. Please don't try to do that. Never overwrite. Please make sure that your pharmacist and your patients know that you are a doctor who never overwrites. Even if that patient shows that particular prescription to his wife, that wife should say, that doctor, no, 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 he never overwrites. Or how he's overwriting? If we have a need, of course, mistakes are very much common. If you want to overwrite, strike out the prescription and take out a new prescription. Or if you want to write down the same prescription, you just put a signature nearby. And most importantly, while writing down the drugs, please make sure that you write down in a chronology based. Chronology based means please make sure that the injections are written first. The solid forms of drugs are written second, like tablets or capsules. And also make sure that the liquid forms of drugs are written below that. Please don't write syrup, tablet, and the last injection. No, please follow the same order. Injections first, solid drugs second, and the liquid form of drugs in the third. Clear? With this, I think we have finalized, guys. We have finished about how to write a prescription. Myself, Dr. Nilesh, I'm there in Insta, and also I'm there in Facebook. Please with the same, this is the ID which I'm just showing it here. Dr. Nilesh Govindraj, which is there in Insta, and Dr. G Nilesh Raj, which is there in Facebook. Also, I'm there in Telegram, and also I'm having a separate community in WhatsApp also. I request you all to just join that. Make sure that you write down the prescription, and make sure that you make this prescription to be your signature. Whenever a patient sees a prescription, it must be like this is from this particular doctor, even if the doctor's name is not written there. I seriously thank Calicut Medical College and the Union, and especially I seriously thank MedMeet, and most importantly, Dr. Rahul Rajiv sir, who actually asked me to give a talk on this with Calicut Medical College. I'm very much happy on it. Thank you so much, Dr. Nandana and Dr. Henna. And you guys were very much supportive from the start. You were continuously in touch with me, and I seriously thank you so much.
Thank you, sir. It was an extremely useful and informative session for us, the future doctors. Once again, I thank you for this wonderful session on behalf of our college union. Thank you all, and bye for lecture one. Meet will in next session. Bye. Thank you.
Bye.